Welcome everyone, I'm Wayne Champion, I'm the CEO of the Riverland Mallee Curong Local Health Network, and I'm here to start our annual public meeting. For those people online, welcome, and for everyone in the room, welcome as well. I haven't counted, but we've probably got about 30 people in the room, and obviously we've got people online as well, and there'll be people that might watch it later afterwards at their leisure online. So we'd just like to start by acknowledging the Ngākat people as the traditional custodians of the land and water that we're here on today in Karoonda. I also want to acknowledge the traditional custodians of all of the rest of the Riverland Mallee Curong region and the traditional custodians of other countries that people might be joining from online. On top of that, I want to acknowledge that for the Ngākat people, and in fact for all First Nations peoples, their culture and beliefs are important focus of their past, present and future. I want to acknowledge the cultural authority of other people joining on from online. And I just want to remind everyone in the room really that everything we do as a health system, as a health network, and in fact even just small things like our attitudes, beliefs, a smile, our behaviour can make a huge difference to the cultural acceptability, availability and access to health services for all people, including Aboriginal and Torres Strait Islander people. We'll go on to the next slide. So just a little bit about the Riverland Mallee Curong Local Health Network. We serve a population of about 70,000 people, really along the length of the River Murray as it flows through the state of South Australia, and of course also the Mallee, or the land to the east of the river across to the Victorian border. We won't go into that a lot of detail, it's up on the slides there, but we have health services in 12 of the larger towns, and also clinics in Tintinara and Canalpin in that region. The first bit of official business really is to note the Governing Board's annual public meeting minutes, which are available here in the room. The minutes have already been endorsed by the Governing Board of the Local Health Network, so we're really just noting them. And so we can consider that done really. And with that, I'll hand to Elaine Ashworth, who is the Chair of the Governing Board. Welcome, Elaine.
Thank you, Wayne, and welcome everybody. And again, as Wayne has already acknowledged the Aboriginal traditional owners of these lands, I'm fortunate to live on Errawong land, a bit to the north of here, and we recognise the importance of everything we do every day to those people. So just presenting our activities, I suppose, for the last year. We've had some changes in Governing Board in the last year or so. So at the beginning of June 2024, we welcomed Robin Valentine, who's over here, to the board. And then in January this year, Dr. Peter Joyner retired from the board, so he stepped down as chair at the end of June 2023. I'm trying to make sure I'm getting to 24, get my years right. And we welcome Dr. Peter Rishbeth, who joined the board in January to replace Peter Joyner. So it's wonderful having another ex-GP who knows the area so well on the board. Robin also is a resident of well, sort of Lameroo, but a bit out of Lameroo, so... Yeah, okay. So it's great we have representation across a wide geographic area and also representation from a whole range of skills. So it's a skills-based board, it's not a locally based board, but we within that have managed to get a good representation geographically as well. So between us, you can see the list of expertise that we have. Many of us have worked in health or related areas for many, many years, some of us for too long. Too long to remember is probably what I should say rather than too long. We have board committees for finance, clinical governance, aged care and disability, and audit and risk. And the board is very focused on looking at our own performance. So we do self-evaluations every year, and in the last year we've had a real focus on regular training. So pretty much every month we've had some sort of an external training focus, aged care, disability, a number of the things, because we provide such an enormous range of services. To keep up to date on the governance requirements of all of those types of services requires a really strong focus, and so we've really focused on that. You can see some of the activities that we have undertaken. We get around, we try to visit as many sites as possible during the year, take our board meetings, meet with the local staff, residents, patients, and increasingly also scheduling meetings with the HACs during those visits as well. So I'll leave you to look at that lot. Okay. The RMC has launched a number of plans and strategies over the last year, and you can see the list of them there. Behind every one of these is a whole heap of work, a whole heap of consultation, enormous amounts of consultation, and I'm very proud of the fact that we focus so much on consultation with communities, with residents, with patients, with staff, in the development of all the things we do. You'll notice there that we've endorsed the Clinical Services Plan, and there will be further discussion about that shortly. And our focus is now, well, probably the biggest focus at the moment is focusing on refreshing our strategic plan, but then also under the Clinical Services Plan, starting to look at the clinical services plans for individual sites. So it's a huge piece of work and very important. Okay. So what have we done over the last year? What has RMC done? Because the board is there to support the staff in what they do for our communities. So continue to support consumers, aged care residents, especially around things like COVID-19, which, although people seem to think has gone away, certainly hasn't gone away. Influenza, respiratory virus has been, both winter last year and winter this year have been incredibly busy with those demands on our services. Maintained accreditation, which is again very important. We, through RACE, have hosted a couple of conferences. So this one just last week, which will be reported in next year's report, but the Research and Education Conference, and again, launched the Narrandjeri signage project, and you can read all of those. Importantly, we have an awards night once a year, and this year, so that was in June, we focused on everyday heroes within our health service. So there are so many staff who go above and beyond every day that we wanted to make sure that they got acknowledged as well. Also, incredibly, the number of staff we have had for very long lengths of time within our services is just amazing. And of course, the focus on implementation of the new Aged Care Act that came into effect just last Saturday. That's been an enormous amount of work, enormous amount of change, enormous amount of opportunities, but also challenges within that we need to address. Okay. Consumers are what we're all about, what we're here for. And the board focuses a lot on understanding the needs of consumers and carers. I'm a carer myself, so that nobody gets to forget that they're an important part of the equation. Community at the centre of care. We've got a board consumer and community engagement strategy, and we have a whole range of strategies that we, both within the health service but also the board itself, does to hear from consumers. So as I said before, we visit sites and we talk to residents and patients, we talk to HACs, but one of the things that I think is really, really valuable is both the Clinical Governance Committee and the Aged Care and Disability Committee regularly have consumers come and talk to them about their experiences. And through that, we hear lots of things that are really important to people but don't come through any other way. And there's been a whole range of changes that we've been able to make within the health service through that feedback from consumers. So that, I think that's one of the most valuable things in terms of consumer engagement. And you'll see a whole list of things that we do. So, Health Advisory Council is a very important part of the picture as well. The board supports the HACs and their advocacy work for our communities. We've developed and launched a range of promotional materials, including posters, pull-up banners and brochures to help the HACs engage more with their communities. We hold an annual conference. We supported some HAC members to go to the regional conference in the Barossa last year. This year's is next week in Port Lincoln. So there's a number of our HAC members going to that as well, as am I. And you can see a list of some of the initiatives that HACs have undertaken. Every HAC's different, every community's different, as you all well know. And so the things that the HACs do are responsive to what the needs of their individual communities are. So Berry Barmer has done a number of health information evenings or days, but that are more than just that. They're more about interaction, and the endometriosis one actually turned into a political lobbying session. So that was quite interesting. So again, Coorong, lots of local activities. HAC is focused on aged care again, supporting changes and upgrading of facilities. Melanoma awareness, very important. So you can see every HAC has got its own focus, and we're keen to support HACs in everything they do. So I'm not going to go through all of them. Okay. All right. So what are the challenges and areas of focus? So, you know, everybody works extremely hard and there are many, many challenges. Workforce is a major focus for the board, as it is for everybody. We've continued to expand race to include nursing and allied health, and Paul will testify to our focus on making sure that that happens. Race has been incredibly successful with medicine and developing medical pathways. We're really keen to see that happening for allied health and nursing as well, and we're getting there with that. We've got a real vision for growing our own workforce so that we have local people we support to develop locally, hopefully as much as possible, not have to leave the area to train and come back to work in our services. We reward staff. We have a number of staff reward and recognition strategies and a scholarship program to help support those pathways. We're noticing increasing demand within our hospitals, again, not surprisingly, and as I said earlier, the 2 winters have been quite significant. But as well as that, we support statewide initiatives, and Wayne was seconded, is probably one way of putting it, to support the whole state in dealing with the Code Yellow issues in 2024 winter. And was able to initiate some ongoing strategies which have helped with dealing with the demands this year. So we're very proud of the work Wayne does in statewide supports, because of course it comes back and helps us as well. So challenges and areas of focus: aged care and aged care. we've been really focusing on monitoring the changes and supporting them, monitored implementation of the reforms, the transition to support at home as of last Saturday, has been really a huge piece of work and will continue to be a piece of work as we make sure that people are supported through that significant change and changes to legislation and impacts. Disability services has been an increased focus for the governing board, and Richard, who's the chair of our Aged Care and Disability Committee, has enabled us to focus on that as well as aged care. So there's proposed changes to legislation. The impacts are just becoming clear with that and how that might impact on our communities. And we will adapt to provide the best services we can. And that's it. So we'll hand back over to Wayne.
Thanks, Elaine. So, as CEO, I'll just run through a few more of, I guess, the highlights of the last year. And I would just like to start by acknowledging the unwavering support of our staff, our contractors, our volunteers, and our workforce generally in going above and beyond for their communities, for our community, for the patients and consumers, and to ensure the continuity of our health services through times that haven't all been easy. You've heard Elaine talk about, winter demand in 2024 and of course again in 2025. But also it's been quite challenging in terms of workforce generally, in part because the Commonwealth aged care reforms have changed the workforce requirements for aged care, in particular for nursing, some minimum nursing requirements for every single residential aged care facility. And that has made it hard to access casual staff, agency staff for our other services and to recruit staff into our other services. So there hasn't been the capacity within the market that there would otherwise be in terms of workforce. This year's been a period of growth and evolution for the local health network. We continue to be a leader in rural medical education through the Riverland Academy of Clinical Excellence, or RACE, and we've expanded RACE into medical or health and medical research really to make some services available in our region that weren't previously available in our region, and also to provide an evidence base for rural healthcare that's developed in a rural setting. On top of that, we've been expanding RACE into nursing and allied health. And we've seen some of our partner organisations like Flinders University that has campuses in our region start to offer an undergrad allied health degree, a graduate medical degree and so on, which really means that kids growing up in our community can train for a health career in our community, maintain their connection to country in a First Nations health perspective, but also their connections to family, connections to everyone that they've got a relationship with in the community that they've grown up in, and train to become health professionals, which is excellent. And we, can then pick them up in the health workforce, give them postgraduate training, give them additional qualifications, help them specialise, and help meet the needs of the whole of our community. It's also been a busy year in a whole lot of different ways, and I'll run through some of them. We have just recently renewed our White Ribbon accreditation, and I'd just like to, highlight that we have zero tolerance for violence and aggression in any form, and that includes violence and aggression against health workers. We might just go on to the next slide. We're going to talk about the clinical services plan soon. We will make these slides available, so I won't necessarily talk through everything, and I'll skip a little bit that's repetitive. But in terms of some of the highlights, we have led from our LHN, the rollout of the Sunrise EMR across every single regional health network in South Australia, 59 hospitals in 24 months, which I led as chair of the program board that led it. And on top of that, our team, at a time that I was absent because I was seconded to be the state commander for the Code Yellow event that Elaine mentioned before last winter, so without me, led the implementation of the Sunrise EMR within our health network. So do just want to acknowledge the huge amount of work and effort from our team in doing that at a time when I was abducted to lead a different, to help address a different problem elsewhere in the health system. We have, on top of that, progressed the work that we've done in terms of education, hosting conferences, hosting grand rounds, really making clinical education and education about health service delivery available to anyone that is interested, not limited to our region. So our grand rounds run through the Riverland Academy of Clinical Excellence are broadcast globally on the internet. Our conferences, the emergency conference, the conferences that we've run on the single employer model, medical training model that we helped pioneer with the Riverland Academy of Clinical Excellence. The recent conference that we've run, which was actually an international conference on health research and education, are all available to anyone that's actually interested, because we're happy to share our innovation with the world, and we're happy to be driven to keep on innovating in order to stay ahead instead of somehow hiding what we're up to. We have progressed our operational plan, which really reflects all of the actions in our strategic plan and our other plans. So you will be aware that we have a community and consumer engagement strategy. We have a clinician and workforce engagement strategy. Those documents are in the process of being updated at the moment, but the actions out of the existing ones that are currently public, our strategic plan, our mental health plan, our Aboriginal health plan, all of those things go into an operational plan, and we track, if you like, our to-do list on just one list instead of having a list for every single plan, and that one list is our operational plan. So we're monitoring that and have obviously achieved a huge number of goals for it. We hosted last year the second ever cross-border forum for the tri-state area of New South Wales, Victoria and South Australia, and that's aimed at helping troubleshoot the issues that affect communities close to the border. So places like Murrayville and their access to health services in Pinaroo, places like Renmark and their access for some people to health services in Mildura, places like Wentworth and their access to health services in Mildura or the Riverland, places like Broken Hill and their access to health services in Adelaide. So really a great opportunity to collaborate with our neighbours in the neighbouring states and just try and troubleshoot some of the differences in regulation and legislation between the states as they affect healthcare delivery in order to make things as smooth as possible for patients and consumers. If we just carry on, there's just some examples of that, and you can see our Innovate Reconciliation Action Plan and our launch of the Reconciliation Action Plan at Nort, which is an Aboriginal heritage site here in the region. I'll just carry on. I've touched on race. Race really was developed by us as a way of positioning ourselves as a centre of excellence in rural health, and positioning ourselves as a centre of excellence in rural health by ensuring that we're providing high quality care, that care is sustainable, that we're educating and developing the workforce, the future workforce that care relies on, that it's evidence-based, so hence the link to research and our engagement in research in a rural setting, in our own rural settings, that can be applied to health service delivery in our own rural settings. and also to, just in terms of excellence, helping share what we're up to, which is why we're hosting conferences and why we're, literally sharing the secret sauce in terms of how we've developed the RACE clinical training program with the other LHNs, who are, of course, now also, in terms of the 5 regional local health networks in South Australia, implementing single employer medical models, which we helped pioneer through that process. So in terms of research, we have around 40 projects underway currently in terms of clinical trials and medical trials. That's growing all of the time. So that was in 24-25. We were the first regional LHN to establish our own research governance officer role, and we are, we've developed a leadership training program within the LHN as part of the RACE program as well, which is really aimed at developing future directors of nursing, future managers of community health services, future executives and future CEOs for our health network. I think we've possibly touched on most of them. A little bit more about RACE in terms of some of the things that it's done in terms of direct connection to service delivery. We have established a rapid access paediatric clinic in collaboration with RACE and the local schools and the Renmark Medical Centre, really making a paediatric service available in schools that wouldn't have otherwise been available. We have attracted 8 medical interns who have commenced in 2025, and we're on target really to have 50 trainees in the RACE program next year, which will be the 5th year of the RACE program. 5-year training program for medical trainees to go from graduation with a medical degree to fellowship as a real generalist, so a GP with advanced skills in areas of their choice, like emergency care or paediatrics or obstetrics and so on. And an intake of 10 trainees a year, so 50 trainees in progress is the target for that program. And of course, with that, the first graduates are about to graduate and are in the process of graduating from that program. There were some people that have joined part way through their training, so they're graduating, obviously as they complete that program, and the first lot of trainees that have gone through the whole program will graduate next year, which is very exciting. As Elaine mentioned, we are expanding the RACE training programs to include allied health training and nursing training. And as I mentioned, that has included working with our partners to have the undergraduate training for allied health available in our region. And we've always had an undergraduate nursing degree, probably not always, but for a long, long time, the whole time we've been an LHN available in Renmark. Lots of lovely photos of people doing amazing stuff. Some quality and safety initiatives. We are still accredited according to the National Safety and Quality Health Services Standards. We've been accredited for for a 4-year accreditation. That's about to come up for renewal, about to have a midterm assessment at any time. So we're excitedly waiting for the phone call that gives us 48 hours notice of an impending accreditation assessment. On top of that, all of our residential aged care services are fully accredited. They can have unannounced visits or assessments at a door knock, so we don't get 48 hours notice for them. So they're excitedly waiting all of the time, expecting an assessment. And our food safety service, our food services and so on are all obviously accredited and assessed against the relevant standards, as is everything else that we do that's covered by some regulatory framework. Some other initiatives. So we've had a real focus on closing the gap and on implementing the National Closing the Gap Agreement and reforms, and a lot of that is about partnering with other organisations. And so you can see, for example, here, myself signing a partnership agreement or an agreement with Merindee Aboriginal Community Controlled Health Service, and that really is the start of a process that will lead to them having more influence in some of the decisions that the health network makes with regard to Aboriginal health. It's also likely the start of a three-way partnership because their geographic footprint includes part of Barossa Hills Fleurieu Local Health Network, and so we'll work with our sister health network to collaborate on joint initiatives with Merindee Aboriginal Controlled Health Service. On top of that, some of you will be aware that we've had the Reversing Diabetes Research Project. The Ngari Yanan, I'm sure Paul can say it far better than I can. Yep. Ngari Yayan, which really means really good food and eating, a co-designed program supporting diabetes remission in First Nations people, which is associated with a plethora of research that we've been undertaking through the Riverland Academy of Clinical Excellence. We have been managing and are still managing in partnership with Public Health Unit in town and the TB unit in the Central Adelaide Local Health Network, a tuberculosis outbreak that's affecting a variety of different community members but was first identified in Aboriginal communities. Obviously, some of you will have seen in our socials and so on, we've recently unveiled some Ngarrindjeri language signage, interactive signage with online spoken language around Murray Bridge Soldiers Memorial Hospital, and that will be expanded across our other health services that are on Ngarrindjeri country. On top of that, we have an Aboriginal scholarship program within the LHN, which is open for 2025 submissions. We've expanded the Riverland clinics at the Aboriginal Wellbeing Centre that we run in Palmyra, including a whole raft of different things, elders groups, hearing clinic, optometry, a whole raft of different allied health clinics, paediatric clinic, and student-led clinics as well, which interestingly are finalists in the SA Health Awards coming up in a couple of weeks' time. We have more than 40 Aboriginal community members participate in a breast screen and breast awareness session, and 25 of them resulted, were breast screened as part of that process. We have cultural immersion programs and educational programs really for every level of staff member in the organisation, and a continued commitment to address racism in all its forms within the health network, regardless of who the perpetrator of the racism is, so whether it's a patient, consumer, staff member, or whoever. Go on to the next slide. And you can see there just some of the great awards and so on that our team have been up to, and you can see what the Ngarrindjeri language signage looks like as well. Lots of initiatives across the whole organisation in terms of recruitment. So we've welcomed 21 registered nurses and two midwives through the Transition to Professional Practice program. We've welcomed 3 enrolled nurse cadets. We have supported 36 Aboriginal families through the Tamaki Tanyeri Aboriginal Family Birthing Program. Celebrated, obviously, International Nurses Day, and mentioned before the planned changes with extending the place-based education into nursing. And see lots of exciting photos of our nursing workforce. Also, in terms of allied health or community and allied health, we've extended clinical services in the Aboriginal health team, including children's drop-in clinic. Aboriginal staff have been recruited to provide a dedicated Aboriginal support at home program, as with the name change 6 days ago. We have 11 new allied health professionals who are completing their graduate year within the LHN, and we've introduced an advanced education and research lead for allied health, as well as implementing a lymphedema nurse. We've commenced the Inklings program, which is really designed to support youngsters, so babies aged 6 years to 18 months old, who are showing differences in their interaction and communication to what's considered normal. Developed a community aged care workforce model to support the transition to support at home program with the new Aged Care Act that took effect 6 days ago, and implementing celebrating the Allied Health Professionals Day and any discipline-specific days as we go through. Mental health, I mentioned earlier that we have a mental health plan that was launched some time ago. Continue to deliver actions against that mental health plan. That includes promoting initiatives like Are You OK Day. It includes celebrating Mental Health Month. It includes implementing a whole lot of actions in the Towards Zero Suicide plan, and includes initiatives really aimed at retaining and supporting training and development for mental health nurses. And part of any program within RACE will include a focus on mental health training, because there are some specialist postgraduate qualifications required to work as a mental health nurse. And we've implemented mental health first aid training across the LHN, and we have trained trainers within the LHN to deliver that. Next slide. Workforce, we have our own workforce strategy which we launched in the last year. We have really targeted international recruitment across a number of disciplines. We've been quite successful with some of our international nursing recruitment. We've really aimed to be proactive around reducing our reliance on agency nursing through that international recruitment and through targeted recruitment across the LHN. We've awarded 18 scholarships as part of the LHN scholarship program. We obviously have LHN awards, and anyone that's looked at our Facebook page will see lots of celebrations of those awards as a way of recognising just a whole lot of the hard work and effort that our staff put in. And we've implemented training areas of focus, have developed a staff handbook, and of course are working with our workforce to get them accreditation ready in terms of mandatory training requirements and all of those things. Some of this is repetitive. As I mentioned before, the corporate team in my absence rolled out Sunrise EMR across the LHN and did a fantastic job of it, along with our nursing and medical workforce teams. And on top of that, of course, we extended it into allied health as well, so really touched every part of the organisation. We've invested in new biomedical equipment, minor works and building upgrades. We have now completed the sterile supplies department redevelopments for Riverland General Hospital in Loxton, including addressing every known defect. And on top of that, we've conducted works at a local level to address concerns around Renmark and Waikerie. So lots of work on supporting the ongoing safety of our surgical services. We've implemented a 24/7 administration team model at both Murray Bridge and Riverland General Hospital that allow the Sunrise electronic medical record to be a real-time information system with real-time data entry when patients are admitted, including centralised data entry after hours when they're admitted at one of the smaller sites. Implemented the operating room management information system in our two larger acute hospitals, implemented a waste management and recycling program at Murray Bridge Soldiers Memorial Hospital, which was really a passion project led by some of our staff, and commenced the helipad upgrades across the local health network. And some of you will have seen the recent media around Riverland General Hospital's helipad now being open for use. as is Meningi's one. Mallee Medical Practice, we have opened a new GP practice here in Karoonda, hopefully providing some certainty to the community around access to GP services and primary health services into the future. We have successfully recruited some new doctors to the service, expanded the pre-anaesthetic clinic at Riverland General Hospital, established a fracture clinic, which was a participant-led project out of the RACE Clinical Leadership Program at Riverland General Hospital, and increased consumer representatives on our committees within the organisation through an expression of interest process, and gone through a change process really so that we're always bringing fresh consumer perspectives into those committees. Whole of congratulations here. I won't read them through them all, but really, you know, lots of people doing really amazing stuff. So Daryl Barnes, Aboriginal Nurse Leader, was a finalist, in fact a winner in the South Australian Nursing and Midwifery Excellence Awards. Professor Paul Worley, who's in the room here with me today, Lifetime Membership Award for the Rural Doctors Association for outstanding leadership and advocacy of care, and also received one recently from the South Australian Medical Training folk for for a lifetime achievements as well. Peter Rishbeth, governing board member, in the room here with me as well. Recognised as in the King's Birthday Honours list, so that's fantastic, for a lifetime of commitment as a rural GP and advocate for rural medicine really across South Australia. Some of our staff at Mallee Medical Practice, Citizens of the Year, so lots and lots of different levels of achievement at lots and lots of different parts of the organisation, and really great to see. And with that, we're about to switch to the finance section, but I might just mix it up a little bit, having just gone through this presentation, and ask if there's any questions following from the presentation. We'll have another questions session later where we might talk through some ones that we've received online, but straight from the presentation, are there any questions? And in asking that, I'd also encourage anyone who's online who's perhaps thinking about a question to think about any questions that they might want to ask, ready for when we open up for questions after the finance section as well. So are there any questions in the room? Odds are, if you're thinking it, there's another 5 or 6 people also thinking it, so feel free to ask it. Okay, we'll come back to questions afterwards, so you've been forewarned to think about any questions. Well, I'll hand over to Craig Lukeman, our Chief Financial Officer, to give an update on the LHN's financial performance, and then we'll come back to questions. Yeah.
Thanks, Wayne. Good evening, everyone. I'm Craig Lukeman, the Chief Finance Officer. For those who don't know me, I think I know most of you in the room, but just in case. To run through the financials very briefly for the year that's just finished. The budget result is there, but I just wanted to touch on our actual results to begin with. Our income exceeded our expenditure by $3.5 million in the year ended 24-25, so that was a reasonably satisfactory result. 12.8 million favourable to budget. The interim result showed a $10 million budget overspend, but DHW did in this year, as they do in all years, and they topped up our budget at the end of the year by about $24 million. So that took us to just under 13 million favourable to budget. Our expenditure for the year was 258.1 million, so about $250 million, so quite significant. Net assets at 30th of June, 154.5 million. Now, on your tables tonight are the annual financial statements as well as the independent auditor's report. Jeanette reminds me every year that those statements are technically embargoed for quite some time yet. So they are available for you to view, but they're not available for us to distribute more widely. So I'll just remind you of that, and happy to answer any questions. Thanks. No questions? Good. Thank you.
Okay, so we did earlier have a couple of online questions, so I might just address some of them. So the first one was a question about the Stoma nurse position in Murray Bridge. The Stoma nurse position, some of you will be aware, is currently vacant. It's vacant due to resignation. The position still exists and we've been recruiting to fill the position. We actually made an offer, or we're on the cusp of making an offer to someone, but they advised that they've withdrawn because they've accepted a position somewhere else. So we're going back to the market to fill that position. So it's still budgeted, still exists, we're still seeking to fill it. And in the meantime, our community nursing team can provide stoma therapy services and can provide a link to stoma nurses elsewhere for specialist advice if required. Next question was a question about some of our publications, and really why don't we showcase people with disabilities more in some of our photos and materials. Not everyone that has a disability necessarily has a visible disability. And so there may well be people in some of our documents and so on that don't have a visible disability. So I, for many years, was a carer of my son who's visually impaired, for example. Most people wouldn't know that he's visually impaired, but there's lots of special interventions put in place around his education and his ability to read and sitting up close and colour contrast with presentations for teaching and so on, in order to get him through his schooling and then ultimately university as well in his case. But so we do actually have, when we sort of picked up on that and looked through it, quite a few presentations that do have people with visible disabilities in some of the photos, but it's certainly some feedback that we can take back and consider when we produce our documents and our documentation. In that same question, there were some probably more specific issues relating to an individual complaint, and rather than discuss that here online in front of the world, we'll take that up, feed it back to the individual who has made the complaint if we can identify who they are. Certainly, accessibility of our health services for people with a disability is a key issue. We are, of course, an NDIS provider. We're not a massive NDIS provider. It's almost a byproduct of being a health services provider as opposed to being a core business, but we are accredited, as you saw before, against the NDIS standards as well. Now, are there any other questions from anyone? Those are the two questions that we received online earlier. Okay, the next thing. The next thing is to invite a couple of people up to launch our clinical services plan. So clinical services plan is sort of the next bit that sits underneath a strategic plan, if you like, that says, here's the list of services that our community are telling us we need, that the population demographics are telling us that we need, and that our projections into the future tell us that we'll need. And here's sort of how we plan to go about implementing them into the future. So do you just want to acknowledge that a huge amount of work has gone in from a massive number of people, including lots of community consultation. You'll probably hear about some of that soon. And invite Kerry Dix, who's in charge of leading service design, and Caroline Fegan, Dr. Caroline Fegan, up to talk about it. And so, Executive Director of Medical Services.
I just think I will. Yep. Thank you, Wayne, and I am really pleased to be here tonight and super proud to be launching the clinical service plan. It has taken absolutely a fair while to develop. It's been over 18 months, and we are really proud of the work that we put into developing it and the amount of engagement that we conducted, the amount of analysis of data that we went through as well. So really proud to be launching this plan. It's a document that outlines what our future needs are, what the services are that we will put in place, and a plan to actually make that a reality. In terms of the vision and purpose, it really is about to improve the health and wellbeing of our community. It's about making sure we provide the range of services that our community need. And the plan really, I mean, we know our services are really well valued by the community, so it's about how do we advance those services to meet the future needs, to meet their needs and ensure that we're offering that really high quality, safe services to each of our community areas. Thank you. How it was developed, this is really what I want to talk about, because it's a co-design process. There has been so many fingerprints. I would have loved to have done a poster of all the fingerprints of people that have contributed to it. It's a co-design process, and to me that really means listening deeply to those who deliver and who receive our services, and ensuring that that learning creates those future directions for us. We developed a design team, so we had a design team that led the process. So shout out to Caroline Fegan, who will share some things in a moment, who co-chaired that design team with Karen Hollett, who can't be here today, our Executive Director of Nursing. We had two fabulous consumer reps who were on our design team. So shout out to Josie Nelson, who's the Barry Barmera Health Advisory Council presiding member, and Kathleen Gregurki, who was a consumer rep for us. Both of those hugely passionate about local services and really holding us to account in terms of how we can improve the services that we offer. We also had our clinical leads on the design team holding us, making sure we were focused on all of our service areas. And it's a very complex process to develop a clinical service plan across our entire LHN. With all of the different nuances at the individual level as well as the collective. And in addition to that, I just want to shout out to Bron Venning, who helped us from the Rural Support Service, who was at that point in the Rural Support Service in the Population Health and Planning team. So it has been a really big piece of work. I'll just check my notes. One of the things that we dug really deeply into at the beginning was the data. So we really wanted to understand our community's needs, what the future of those needs were, to understand not just our mainstream population but also our smaller, more vulnerable community groups that we wanted to make sure we reflected in the plan. So we dug into that data, we dug into our service utilisation data, so who was using our services where, what those trends were over time, and of course what the future projections are based on some of that trend analysis. The other thing that was hugely important was the consumer engagement process. So we really made sure that we did the consumer and community engagement first alongside the data analysis so that we could take that to our clinicians and staff. So we undertook some detailed interviews with staff with consumers, so that we could understand what their experiences were like. So it wasn't just about the what we're delivering, but also the how we deliver our services. So we did some interviews with staff, we did, with consumers, we held focus groups, we had a big survey that went out to community, and we brought all of this information together, the data and the consumer insights, to our clinicians and staff and partners to actually unpack all of that and work out what the future direction was. So that was for me. I'm really proud of the work that we did. I know that there are a lot of people who provided really solid input, and really grateful for that. Like I mentioned, I just wanted to reinforce that this plan has been developed on what our consumers have told us that's important and what our staff have told us it's important. So it's from the ground up very much. And now I'll hand over Caroline Fegan, our Executive Director of Medical Services, to chat with you about what the plan actually means for our communities.
Thank you. This is it. Very exciting. So if you don't have a copy, please grab a copy. It's our clinical services plan. It's nice and heavy. But as Kerry said, the thing that's been the most wonderful about this, before I go on to what it aims to do, is that we've built this for consumers with consumers and for our staff with our staff. So it's been built through our communities, and I use that term broadly, and it's been built by engaging with our communities right at the beginning. It wasn't something we put to them and said, hey, what do you think of this? You know, it was really from the ground up. It was built with consumers for consumers, our communities and our staff and all our stakeholders. And I think that's really important, and I think it reflects in the plan itself. So I've got to sit on the So what does the clinical services plan aim to do? It's about improving health and wellbeing of our communities. And that's by providing a range of services, some which we already provide that we wish to strengthen, and some new services that we want to advance to. We want to advance the healthcare services that we provide, and it's not just about, when we provide those more services, it's about integrating that care, providing care closer to home, providing care on country, which is really important to us, and reducing the inherent geographical narcissism that we have as rural communities, and the inherent disadvantage with social determinants of health and geographical narcissism in accessing equitable healthcare. That's what this is about. It sets out our commitment as RMCLHN to do this, and to continually design our services to meet the community needs, implementing our strategies for improvement and ensuring the services are sustainable over time, which is really important. Thank you. The opportunities that the clinical services plan creates, I think it's really important to know that. The plan is to provide more services locally in our region, more services closer to home for our communities, and that inherently means a less need to travel sometimes very long distances to receive the care. An example of that is in the clinical services plan. You'll see that one of the goals is strengthening our hub hospitals, which is Riverland General Hospital and Murray Bridge Hospital, and utilising our smaller hospitals and increasing their skills as well, so that we have two larger hubs and the smaller hospitals that all work together and across each other at times to provide support across the whole community. And some examples of that, which Wayne has spoken about already, is the fracture clinic that we've established in the Riverland, the paediatrics clinic, our geriatric outreach services, which we're about to set up, as well as our drop-in services in Barmera and our Aboriginal health clinic. So we've started that process already, and we're planning to continue that further. So in terms of the opportunities that we see the plan offering for our communities, is a greater awareness of the services that are offered locally. Something that was really interesting in developing this, because we did it from the ground up with the consumers. We found that there were services available that some people in the community didn't know. And so some of it was capturing those services and making them visible to everyone and celebrating them and strengthening them as we needed to. Provision of excellence of high quality clinical care. And an example of that is that as an LHN, and Wayne sort of touched on this in his presentation, our LHN has taken the approach of being responsible and investing in our future and in our communities. And it's not just in our hospital services, but our whole communities, including allied health, our primary care services. We've taken that responsibility on, that we care for the whole community, not just a little bit of it. So I think that's really important, and that's really reflected in this. An example of that, which Wayne's already spoken about, is the Riverland Academy of Clinical Excellence, which has been highly successful for rural generalist training, postgraduate rural generalist training. And we've got 47 trainees. We're in our 5th year of training. I went to the RACGP fellowship ceremony on Saturday, just gone, and we had 6 trainees go across stage who had joined after internship. So there were 6 trainees who had touch points in our system already, who had just gained their GP fellowship, and there was 4 of us that went across stage for our rural generalist fellowship. So it's a great program that's developing. As Wayne said, our first set of doctors who have started from internship all the way through to rural generalist fellowship will be graduating in 2027, which is going to be fantastic. And I think it's a really good example of how the clinical services plan, this creates opportunities. And the great thing is that now we've got that established for medicine, we're then going into allied health and nursing, which is so desperately needed, to be able to support those workforce as well for our communities. It is important that we work with the community, and that's really reflected in it, to continually ensure that we're providing the services that are culturally safe and also appropriate, that they're high quality services. Just because you live in regional doesn't mean you should get a different quality to what you get in a metro service, and I think that's really important, and it comes through in what we do. And we've also, as we've already discussed, about developing to be a provider and employer of choice. And Wayne's talked about that with the end-to-end nursing, allied health and medical training that we now offer in the region. And I'd just like to take this opportunity as well. Kerry and I have done this for, how long has this been now? The plan? Yeah. 2 years. 2 years since we started, 2 years since we had the idea. And I'd just like to thank every single person who's been involved. As Kerry said about the touch points, I really wish we'd done a piece of paper and got everyone to do their fingerprint on it when they've turned up to one of our workshops, because there would literally be hundreds and hundreds. It would fill this entire thing. We've had so many workshops here in Karoonda in particular, and we've had hundreds of people attend to give and it's been varied from stakeholders, staff, community, other members that came along, other critical stakeholders in health that have come to provide their input into what they feel we should do as an LHN. And we've been so incredibly grateful for that information, because it's really been able for us to contextualise that information and be able to make it real for our communities. So thank you all very much.
Concludes the Local Health Network annual public meeting, unless we have any other questions that have been posted online. So no other questions. So I'll call the annual public meeting to a close and hand over to the Mallee Health Advisory Council so that they can have their AGM.